A warm welcome to all. Today I am going to share with you the topic Gout. Myself, Jenisha from Emmanuel College of Pharmacy. Initially, what do you mean by gout? Gout is a metabolic disease in which plasma urate concentration get increases. It's also known as hyperuricemia. Have you ever noticed that the people suddenly affected by severe pain, especially in the toe, without any injury? The condition is called gout. Yes. Gout is a metabolic disease which causes the deposition of monosodium urate crystal in the joints, elbow, ankle, and synovial joint. The tiny needle structure is deposited especially in the joint. This condition is characterized by redness of the hand, injury, as like pain and intense pain. Uric acid is the production of purine metabolism at low pH, has low water solubility. When urate level increases in blood, it gets precipitated and deposit in joint, kidney and cutaneous tissue which is called as tophi. Causes: overdrinking of alcoholic beverages, especially beer or purine-rich food, leukemia, lymphomas, polycythemia condition treated with chemotherapy, radiation causes enhanced nucleic acid metabolism and uric acid production. Drugs like thiazides, furosemide, pyrazinamide, ethambutol, levodopa clafibrate reduces uric acid excretion by kidney and produces gout. Anti-gout drugs. These are the drugs which are used in treatment of gout condition, which are act by one of the following mechanism. The mechanism are as follow: inhibiting uric acid synthesis, example allopurinol, increasing uric acid excretion. The drugs which are used to treat are prophylactic, then inhibiting leukocyte migration towards joint. Example of the drug treat or colchicine. Producing generally non-steroidal anti-inflammatory drugs action. Example of drug used against or glucocorticoids. Classification: the gout is divided into two types: acute gout and chronic gout. Acute gout is a painful condition that often affects only one joint. Drugs used are NSAIDs, colchicine, glucocorticoids. For chronic gout or hyperuricemia, chronic gout is a repeated episode of pain and inflammation. More than one joint may be affected. Example of the drug or allopurinol. First, NSAIDs drugs. Various drugs used are indomethacin, naproxen, pyroxam, diclofenac or hydroxyzib, given at high and repeated dose to terminate attack. Produces responses slowly as compared to colchicine, but well tolerated, so more preferred than colchicine. Naproxen piroxicam inhibits chemotactic migration of leukocytes in the inflamed joint, but not recommended for long-term management due to the risk of toxicity. Colchicine. Alkaloid from Colchicium autumnale or crocus, found as antigout in 1763 and isolated as pure form in 1820. No having anti-inflammatory or analgesic activity, but used specially in treatment of gouty inflammation. First dated information of colchicine was able in ether Papyrus Eber, and it is written in about 1500 BC. Process of gouty inflammation. Precipitation of urate crystal in synovial fluid start inflammatory response by producing hemostatic factor, migration of granulocytes into joint which propagates urate crystal. Its resultant release of glycoprotein increases lactic acid production from inflamed cells, decreased pH. More urate crystal get deposited and affect joint. Then here releases lysosomal enzyme joint destruction. It gets worst in inflammatory condition. Mechanism of action of colchicine. Colchicine bind to fibrillar protein tubulin. Depolarization of microtubules. It decreases the cell motility. Then here precipitation of urate crystal in synovial fluid. Start inflammatory response by producing hemostatic factor, migration of granulocytes into joint. It results in symptomatic relief for gout. Other action of colchicine. Antimeiotic binding to microtubules of mitotic spindle. It's get arrest the metaphase tried for cancer chemotherapy but causes toxicity. This increases the gout mortality through neuronal mechanism. Pharmacokinetic absorption is absorbed easily through orally and distributed uniform metabolism liver. Limitation bile undergo enterohepatic circulation, urine and feces. Types of colchicine. High and dose colchicine. At therapeutic dose, nausea, vomiting, or bloody diarrhea and abnormal cramp. Accumulation of the drug in intestine and inhibition of mitosis. In overdose, colchicine produces kidney damage, CNS depression, intestinal bleeding. Death is due to muscular and paralysis and respiratory failure. Chronic therapy not recommended because it causes plastic anemia, myopathy and hair loss. The drug interaction with other drugs such as colchicine slow interaction with other drugs some of us. Cholesterol drug atorvastatin, fluvastatin, lovastatin, gemcitabine, indinavir, astanavir, nefinavir, prianavir. These are the HIV drugs. Then antidepressant drugs are nifazodone. Antibiotics are clarithromycin. Antifungal are ketoconazole or itraconazole. Calcium channel blockers such as verapamil. Serious muscle damage. It increases the concentration of colchicine. Stomach pain, constipation, diarrhea, nausea, or vomiting. Uses of colchicine. Treatment of anti-gout. Best drug to get control for attack. Prophylaxis condition for gout. Prophylaxis condition for gout. Colchicine 0.5 to 1 mg per day. Prevent gout attack, but nowadays NSAIDs are preferred. Used in plant breeding by introduction polyploidy of a cell or organism needing more than two pairs in plant cells for a new or improved variety strain and culture. Cortisone, corticosteroids. Intra-articular injection of soluble steroids suppresses symptoms of anti-gout. Corticosteroids decreases the pain, swelling, redness of gout. But corticosteroids are used only for patients suffering from renal failure or peptic ulcer. Risk of rebound of attack is observed on drug withdrawal. Example, prednisolone 40 to 80 mg given once a day. Liquid soluble organic acid developed in 1971. These are the intro about profenixid. Probenzine block active transport of my organic acid gate by blocking inhibits causes excretion reabsorption by active transport. Pharmacokinetic absorption rapid orally distribution 90% bound to plasma concentration. Metabolism liver excretion urine. Drug interaction with other drugs such as antibiotic, penicillin, cephalosporin, sulfonamides inhibit the urinary excretion. NSAIDs, indomethacin salicylate, antibiotic, rifampicin, antimicrobial, nitrofurantoin. Toxicity, dyspepsia, rashes and other hypersensitivity. Toxic dose cause convulsion and respiratory failure. Uses chronic gout and hyperuricemia. Second line are adjunct drug to allopurinol 0.252 to 0.5 gram BD gradually lower blood urate level although with arthritis. Tophi and other lesion but ineffective during renal insufficiency. Plenty of fluid should be given with this to avoid urate crystal deposition in the urinary tract. Prolonged drug action. It's used to prolong penicillin action by enhancing and sustain their blood level. Example, gonorrhea, subcutaneous bacterial endocarditis. Sulfenpyrrazine. It is a pyrazolene derivative related to the phenylbutazone having constant uricosuric action or having anti-inflammatory or analgesic activity but used especially in treatment of gout inflammation. Mechanism of action: it inhibits tubular reabsorption of uric acid, also inhibit platelet aggregation. Absorption: the pharmacokinetic of the drug given and absorption rapidly through orally distribution 98 bound to plasma protein elimination active secretion in proximal tube urine. Drug interaction: oral anticoagulant warfarin tolbutamine increases the effect. Antiasthmatic theophylline worsening asthma. Calcium channel blockers verapamil high blood pressure or an irregular heartbeat. Adverse effects such as gastric irritation contraindicated in patients with peptic ulcer, rashes, and other hypersensitivity reaction. At overdoses, convulsion, coma, anemia, jaundice, and ulceration. Uses used in the treatment of chronic gout 100 to 200 mg BD. Allopurinol. This hypoxanthine analog was synthesized a pure antimetabolite for cancer chemotherapy. It had no antiplastic activity. It is a substrate as well as inhibitor of xanthine oxidase, the enzyme responsible for uric acid synthesis. Allopurinol is converted into alloxanthine. That step inhibits both xanthine oxidase enzyme and change their function hypoxanthine to xanthine, and finally it leads to uric acid. Rapidly absorbed through oral, not bound to plasma protein. Metabolism during chronic administration inhibits self metabolism. Elimination 1/3 excreted as unchanged form in urine. Drug interaction anti-cancer 6 mercaptopurine and azothioprine. Uricosurium theophylline. Profenicid. Anti-asthma theophylline. Hematinics iron therapy. Adverse effect of allopurinol: hypersensitivity, rashes, fever, malaise, and muscle pain. Stevens-Johnson syndrome, gastric irritation, headache, nausea, and dizziness. Infrequent liver disease. Uses of allopurinol, drug of choice in chronic gout to potentiate 6-mercaptopurine or azothioprine during cancer therapy and immunosuppressant therapy. In treatment of Kala-Azar, inhibit leishmania by altering purine metabolism. And finally, thank you for your attention. Today, we have a quick summary of our project, of our slideshow. Initially, gout is a chronic disease which causes inflammation in the monosodium crystal and which causes inflammation and characteristic pain. Look at the picture. If you have any doubt, ask me. Thank you for your attention.